Good morning, everyone. Welcome to the Healing Centered Engagement presentation. My name is Kyla Liggett-Creel. I'm an assistant clinical professor at the University of Maryland School of Social Work and also the lead strategist at the Office of Youth and Trauma Services at the Baltimore City Health Department. Excuse me. I would love to go ahead and get started and learn a little bit about who all is in the room with us today. So if you all are willing, if you could unmute yourselves and share with us your name and where you are representing or how you're involved with Healing City. I'll start with Dr. Fulton. Is Dr. Fulton on with us yet?
I am. I just ran away and came back. We're introducing ourselves?
Yes, ma'am.
Okay. I'm Jacqueline Fulton. I'm a pediatrician working in the inner city of Baltimore in the Sandtown, Winchester, Upton area. Glad to be here.
Excellent. Thank you so much. And who would like to go next? How about Anne-Marie?
Hi, my name is Anne-Marie. I am a group facilitator at House of Ruth, Maryland. I work in abuse intervention.
Awesome. Thanks, Anne-Marie. Please help me if I pronounce your name wrong. Ziamara Kuno?
Good morning, everyone. I was trying to, I'm in my iPad and I wanted to show my face, but so I am a JHU student, majoring in biophysics, and I am a volunteer in Centro Sol, which is an organization that helps Latino students, high school.
Wonderful. Thank you so much. Carly?
Hi, good morning. I'm Carly Rygard, and I'm the Children's Services Coordinator at the Enoch Pratt Free Library.
Awesome. Thanks, Carly. Jen?
Hi, I'm Jen Eames. I'm with the Zanville and Isabel Krieger Fund here in Baltimore.
Thanks, Jen. Minju?
Good morning. My name is Minju, and I work at the 29th Street Community Center in Baltimore.
Awesome. Thank you. Tiffany? Is Tiffany with us yet? All right, maybe she had to mute in for a second. So welcome to you all. It's wonderful to see you all here. Again, my name is Dr. Kyla Liggett-Creel. I am an assistant clinical professor at the University of Maryland School of Social Work and also the lead strategist at the Baltimore City Department of Health, Office of Youth and Trauma Services. So thank you all so much for coming today. This is going to be an interactive activity. We are going to do some work together on healing-centered engagement. So first, I'd like in the chat box, if you all are willing, and I see more and more people are coming on, which is excellent. When we go into a space of learning, I always like to see if we have shared values that we can bring to the table. So this is your core value of how you try to interact with other people and how you hope other people will interact with you. So an example of a core value could be authenticity or humanity or truth telling. So in the chat box, if you could please put one word that is your core value that you try to use when you are interacting with other people. Love. Great. Hey, Coop. Grace, empathy, wonderful. Enthusiasm, excellent. I always try to use authenticity, empathy, wonderful. So I'm hoping that as we look at these words, we all feel like we can try to live to these these core values, and as a learning community that we use this in our interaction as we move forward for today. One of our goals is to really work on building trust in the community. And so one way to build trust is to have these shared core values so that we all know how we're going to be interacting with each other. The other thing is to learn and share experiences and to build something together. So that takes us to our activity for today, which is learning more about healing-centered engagement. So before we go into the healing-centered engagement, we really have to start talking about, well, what do we mean when we say trauma? So for something, when we talk about trauma, there are three components, okay? And there is the event. And so that is, for example, in the picture, you can see the event is the thing that happened, right? So an event could be a car accident. So the event is what is causing the experience and the effects of trauma. Okay, so the event by itself is not traumatic. It is what causes the response. So when an event takes place and there's like a car accident, then the experience people may have could be fear, right? So they've now been in a car accident and they get frightened because of the car accident. So then we look at the third E, which is the effect. So what effect did that fear have on the person? So for example, if I'm a driver and I'm in a car accident, the event is the car accident, the experience that I have is fear, and the effect could be I don't drive a car anymore. That I say, you know what, I'm just gonna walk, or I'm gonna take public transportation, or I'm gonna ride in a car with somebody. And so when we're talking about trauma, it's important to recognize that people could have a shared event, but their experience and effects could be very different. And we're going to talk about why that might happen. But it is not uncommon that people will have a shared event. It's, there'll be 30 people who witness a murder in the community. But of those 30 people, you could have 10 different experiences. There could be anger or fear or terror or guilt or whatever. And then the effects could be 30 different effects. For some people, they don't go outside again. Some people avoid that area. Some people, they just say, well, this is just the way things are, and they keep going. So all of that is important simply because you can't sort of use a blanket response, because everybody's experience and effects may be different. So let's start off by doing a group activity where we go through and talk about two examples of an event and then what people may experience and what the effect may be. So can somebody give me an example of an event that could happen that causes these, experiences or effects? An event that could be traumatic. And you can unmute yourself or put it in the chat.
The loss of a parent.
Great, thank you. So a loss of a parent, right? And so what might somebody feel if they lose their parent? I see something coming in the chat here. Okay, great. So anger, they could feel a lot of anger about that loss. Heartbroken. Yep, abandonment. Great. Fear. Excellent. All right, and so what effect might that have on somebody? They've lost a parent and they may feel angry, heartbroken, abandoned, fearful. And so the effect may be that now they have a sense of hopelessness. So when it's time to start talking about, well, let's plan for the future. Let's think about, meeting goals. They may say, well, I really just don't have any hope that there's going to be a positive future. So therefore, I don't want to set goals, right? They avoid being close to people. Yeah. So they start to push people away because they feel like I've already had a loss. And so I don't want to open myself up for another loss. Okay. Great. Let's do one more. What's another event that could be something that could be considered traumatic?
Being stopped by the police.
Right. Hey, Janine.
Hey.
Nice to see you.
How are you?
Good. How are you?
Good.
All right. So event could that they are stopped by the police. And so what could the experience, what is the emotional response if they are stopped by police?
Fear.
Anger. Yep. What else?
Fear.
Fear. Yep. And what else? Anxiety. Great. And so what effect might this have on a person long term? If that has happened, what physical effect or behavioral or spiritual, what effect might that have on somebody who has experienced anger, fear, and anxiety from being stopped by police?
Lost the trust in authority.
Right. So because this has happened and there was fear and anxiety, then moving forward, there may be a huge loss of trust in anybody who is an authority because of the fear of what they may do and what harm they may cause. Right. So you can see what else, what is another effect that this could have? That whenever they see a police officer or they see lights in their rearview mirror, what might happen? Inappropriate, yep. So inappropriate response to authority, because now the fear has been brought up, the anxiety and the anger. So now when an authority person comes in, then we're leading with that fear and anxiety and anger. And so then our response may be leading with that versus maybe the authority person is saying, well, okay, I was just going to say hello. But now we're responding with fear and anxiety because we've had this history of the traumatic events. Does that all make sense to folks about the 3 E's and the ways to understand trauma? Okay, I see a couple people shaking their heads. Great, excellent. So the good news is that we have some ability to manage the effects of trauma. And so this is done through the resilience model. So the resilience model looks at everybody has risk factors and protective factors, okay? And they're in 3 different categories. So both risk and protective factors, there is internal, family, and community. So internal is our health, our mental health, our use of substances. It's things that are about us, right? Our family is who is our immediate support group. And then community are all the places in the community that we interact with. So when we're thinking about risk factors, you know, an internal risk factor might be my health. And so if I have a chronic health issue and I experience trauma, the impact may even be greater because I also have a chronic health condition. For family, if I experience a trauma and I need support and I go to my parents, and let's say my mom has untreated mental health challenges and my other parent is actively using substances. Well, they're not able to offer me the support that I need because they're struggling with their own challenges. So then I go out into the community and say, okay, well, let me get support from the community because they can help me with this trauma. And so risk factors would be, well, let me go down the street. Oh, the first thing I see is a liquor store. Oh, well, let me cross the street. Oh, well, there's 3 guys on the corner who are selling drugs. Those are risk factors, right? Because those are my first supports that I'm looking at and going, oh, well, here's my response. On the other hand, protective factors, internally, it would be, you know, it could be, well, my mental health is very good. I have very, very strong mental health. I have coping mechanisms. So when I experience a trauma, I go right to those coping mechanisms, and that helps me with processing and therefore limits the impact of the trauma. I still need some support, so I'm going to go to my parents. my mom is healthy. She is able and ready to support me. My other parent is healthy. They're ready to support me. So great. Now I have family support. I still need a little bit of extra support. Let me go out into the community. Oh, my favorite teacher knows my name and checks in on me. I'm going to go to the rec center and I'm going to go talk to my mentor after school. And they're going to be like, you okay? You look like something's going on. Now I have another person to talk to. Then I'm going to go to the library and the librarian knows my name and says, hey, what's going on? You look like something's happening. So now those protective factors are going to lessen the impact of the trauma because they are offering that support. Okay. So let's talk about that. So what are some internal protective factors? So things about a person that you can think of when we're talking about internal protective factors. And you can unmute or put it in the chat.
Positive mindset.
Great. Okay. A good mindset. What else? Faith. Yep. And what else?
Like good coping mechanism, like you said.
Great. Yep. Okay. And then what about family? Great. So trusted supports. Yeah. So this would go trusted. So the fact that I can trust is internal. And then for family, support of friends and family. And what else would be a strength in a family?
Listening without criticism.
Great. And what else? Think about, yeah, healthy boundaries and resource support. Great. Excellent. And so now when you're thinking about protective factors in a community, what are some protective factors that you can think of in a community? And think agencies, but also the community space, you know, thinking green space, all of that. What are some community protective factors? All right, so availability and accessibility. Access to comprehensive healthcare. Yep. What else?
Food markets, you know, like access to basic necessities.
Yep. What else?
Non-violent.
Violence?
Like no violence.
Oh, I was like, wait a minute, we don't want violence. Yes, no violence. Great. All right. So here are, you know, if people have these protective factors in place, then the impact of the trauma can be lessened, right? Now, what are some risk factors internally that somebody may hold for themselves?
Suicidal thoughts.
Yep. Okay. What else? Mental health issues. Okay. Distrust. Great. And what about in the family? What are some risk factors that family may have?
Alcoholism.
Okay. What else? Abusive relationships, separation, whether that be from incarceration, divorce, death, and generational trauma. Great. And then in the community, what are some risk factors that you see that may be in existence?
I would say being over surveilled and policed. So I say over surveilled and over police because I think it's two different things. Because sometimes you can be over surveilled, but not by like law enforcement.
Yep. Okay. Over surveillance, over policed, racism, sexism, homophobia, light, lack of resources. Excellent. Good. Excellent. Thank you all so much for helping to fill this out. And one of the things that I want to bring our attention to is that there are some things that we as a community, we can't control, right? So when, you know, if a trauma happens, I can't go back in time and go to, let's say a young person says a trauma happens. I can't go back in time and say, well, let me see if I can fix the fact that your parents are no longer together, or the fact that your one parent was incarcerated 5 years ago. I can't do that, right? There are programs that we can put in place and things that we can do to try to prevent some of those from happening. But in the community, we have a lot of control over being able to put protective factors in place and to decrease risk factors. And we do that through, you know, working on getting grants, looking at creating funding within the city budgets, organizing communities so that they do the work themselves without having to have external supports being put in place. And so, you know, when we look at, you know, access to healthcare, working with the healthcare providers who are in the city and saying, you know, having you be in a hospital down on Redwood is not helpful. We need you to, you know, set up shop at the library or at the rec center or in the school auditorium, because then that's where families already are. And so having that where it's accessible, working with urban farmers about setting up those food markets in the neighborhoods so that families can get to the healthy foods and support the urban farmers in the neighborhoods versus them having to go to a grocery store that is owned by big corporations that are far away that cost a lot of money. And we do the violence intervention and prevention work, right? That we can make sure that there are mentoring programs set up. We can make sure that, you know, there is a presence of community grassroots organizations who can do that prevention of violence. And there can be community organizing to be able to address issues of having over surveillance or over police, and then doing trainings in the community as well as for organizations and businesses around racism, sexism, homophobia, addressing the issues around the blight. These are things that are actionable that we can then get protective factors in place so that when trauma does happen, the effect of that trauma is lessened. So we focus on this because we want to recognize that as a community, if we all work together and build trust to be able to break down some of these silos and really focus on building up supports and building up protective factors, that we can have a direct impact on how trauma affects our young people. So this takes us to understanding about trauma-informed care and healing-centered engagement. So, you know, the work of trauma-informed care started, you know, 20 years, 30 years ago, let's say in a school. If a kid did something like threw a chair across the room, that child had a response that was more punitive. So it was, you know, the principal would come and say, well, you threw a chair, so now you're suspended, or you have detention, or you're expelled, right? That was a punitive response. Trauma-informed care said, well, wait a minute, you know, I think we need to stop with this punitive response because I don't think that's really making a difference. And instead, we need to go to a trauma-informed response, which was a great move. So the trauma-informed response says, well, instead of focusing on what they did, let's focus on what happened to them. And so then it moved from, instead of saying, well, this kid is now going to be suspended, the conversation turned into, well, wait a minute, what's going on? Why are you throwing chairs? What's happening? And through that, people started to realize, oh, the kid who's throwing the chair is in foster care and has been in foster care for 5 years and has had 10 placements. Maybe that's why they're having a rough time. Or the kid who threw the chair, you know, their mom was just incarcerated yesterday, and that's why they threw the chair. Well, suspending them or expelling them does not address that trauma, but saying, well, let's have you go and talk with somebody is going to help them with those protective factors that we talked about, like having coping mechanisms in place, having somebody to talk with. It also said, well, we need to highlight the specific needs of the students. And so really talking about not only do they have trauma, but they also, you know, they need mental health services, but they also need some concrete supports, right? So let's say, you know, they've been experiencing neglect. Well, so we need to get them clean uniforms. We also need to make sure that they have lunch and breakfast when they come to school. We need to sign them up for an after school program so that they can have mentoring after the day is over. And we also are noticing, oh, this child also has a speech delay and a motor delay. And this is as a result of some of the trauma that they've experienced. So we're going to put in special services to make sure that they're getting those needs met. They also said we need to make sure that if somebody has experienced trauma, that we're referring them from mental health services so that they can get therapy to be able to address the trauma that they've experienced. And it also included a whole person perspective. So instead of just saying, well, no, we're only going to deal with this piece, it really was looking at the whole child and looking at their family and figuring out how we could put some supports in place and engage in a different way. So all of that is great, and it's really been helpful, and it's made a huge difference because it means that the children were no longer being just automatically suspended. Theoretically, we know that the reality is that due to systemic racism that continues to happen, that there is unjust application of trauma-informed care. But the theory of it is that this is how it would be applied. Well, so now we're moving into the phase of looking at healing-centered engagement. And so what healing-centered engagement says is, you know, we're on the right track, that, you know, we can't just punish people because they've experienced trauma. And yes, we need to recognize that they have trauma. We also have to celebrate their strengths. And so part of the critique of trauma-informed care is that it became a thing where we were focusing on the worst moment in a person's life and not paying attention to the strengths that they have, and also that they are agents of their own healing. It is not that people need somebody external to come in and heal them. It is about people coming and recognizing that this person is a survivor, they have strengths, they have talents, and that they do have the power to heal themselves. And our role as supporters is to say, you have that strength, you are an amazing person, and to know things about them. So this is where concrete strategies comes into place. If you're working with 7 youth, you should know their names and know what their strengths are. And so, you know, I can say, Elder is wonderful at spoken word. Jamira, who you all heard earlier, and you heard Elder do spoken word. Jamira is going to be a social worker in the future. She's a phenomenal speaker around trauma and mental health. Ania does great work around human trafficking. Lamar does a great job at talking about how sports is a coping mechanism. You know, Taylor is a phenomenal speaker who can get up and really tell a powerful story. She's a storyteller, and she also has a wonderful artistic talent. So notice that with each person, you should know their name, their strengths, and what they're really, really good at. And not only know what they're good at, but build opportunities. Make sure that those opportunities are there to let them show their strengths. Also, focusing on healing is collective rather than an individual process. And so bringing everybody, you know, bringing the whole community together to do the healing work is so important. And so this also is supported by the South African framework and philosophy of Ubuntu, which is I am because we are. It is the interconnectedness of everyone. And so it's really breaking down that idea of sort of like, oh, the people who have experienced trauma, they need to heal. Well, no, we're all interconnected. So the fact that somebody has experienced trauma means that we all need to do the healing work. So we need to not only heal ourselves, but also heal our community, and then make it that our systems are healing focused. And then finally, that the holistic healing involves culture, spirituality, civic action, and collective healing. So this is where the celebration, recognition, and embracing of culture and spirituality come together. And so making sure not only that there is environmental reflection of that. So looking at, do you have pictures on the wall that are reflective of the community that you're serving? Do you have music that is representative? Do you have books that are representative? But also look at the interaction style, the systems that are in place. Are they upholding systemic oppression, or are we working to break down those systems and making sure that we are centering those who have experienced trauma in the conversation versus centering Eurocentric models or quote unquote experts, and they are talking about people versus that people who have experienced it themselves are in the center. And so that then leads to civic action. And so civic action is that people are coming together to engage in action that helps to heal the community. So an example of this is the Healing Youth Alliance, where youth have come together and worked with several organizations such as Heart Smiles, the University of Maryland School of Social Work, and the Black Mental Health Alliance to learn about mental health, healing, and trauma. And then they're going out through civic action and engaging in training, consultation, being very involved in the Healing City Summit like this week. That is an example of civic action, but these are all things that you all can do in your work with youth or the community or your agencies, is thinking of ways that you can implement these various strategies, such as focusing on the strengths of the people that you serve, creating a community of healing, making it clear that we are all connected with each other, and then engaging in civic action and collective healing. Does anybody have any questions or comments about the healing-centered engagement framework? And then we're going to go into an activity. Any questions or comments?
I would like to just a comment to rephrase the trauma-informed care, focus on what happened on them than what is wrong with them.
Mm-hmm.
You say about what's wrong with you. It sounds like a discussion when two persons are talking and they're saying, what is wrong with you? Well, nothing is wrong with anybody, not a human person. It's just the experience that I have been going. So instead of what's wrong with you, like to what has been going on with you.
Exactly. And that's exactly what that shift was, that the trauma-informed care focuses on what happened to them rather than what was wrong with them. And that was the old model, was that, going back to that kid who throws a chair, the response they would get is, what's wrong with you? And trauma-informed care said, well, that's not appropriate. That's not right. We shouldn't be saying what's wrong with you. So to your point exactly, that's why trauma-informed care came in and said, that's not the way we should be interacting on this. We should really be talking about, well, what happened to you, and get rid of that concept of what's wrong with them. So yeah, that's exactly right. Thank you. Other comments, questions, thoughts about the healing-centered engagement?
I would just share like something that I have noticed is even with like the concepts of Ubuntu and collective healing, it seems like sometimes it can feel like it's not working because you're dealing with caked on trauma, right? It's like it's like trauma after trauma after trauma, but you're still trying to use these same approaches. And it's like, well, people can barely heal from the first 5 sets of trauma, and now there are additional 5. So that's something that I've observed for myself.
Absolutely. And I'm so glad you said that. And so, what Janine is describing is that, when you're talking about chronic trauma, it makes it even more complex. That, as one of the mentors that I worked with several years ago said, it feels like you're in an ocean, right? And so you get, that wave hits you, and then you get your head above water and you start to try to do the healing work of breathing and coping and processing, and then another wave hits you. And so you can't even get your feet under you to do the healing work because you're constantly being hit by wave after wave after wave of trauma. And so that's absolutely right, which is why with the resilience model and healing-centered engagement, we focus on building up protective factors, because we're not at a place now where we can prevent all this trauma from happening, right? We're doing the work where there's lots of things happening, but we know that the trauma continues to happen. So what we can control is getting those protective factors in place. And some of that takes place through civic action and collective healing. It also, part of trauma is that your power has been taken away. And so you, in that moment of trauma, you were not able to make choices. So by engaging in civic action and collective healing, it's restarting that power and saying, you are powerful. You are not a passive person. You are not a victim. You're a survivor, and you can use those skills and those strengths that you have to help heal not just yourself, but the whole community. And so that's a key element of healing-centered engagement, is engaging in civic action. And that could be painting murals, it could be doing street cleanups, it could be creating garden spaces, it could do training, it could do, all kinds of activities that you could do. But the point is to engage everyone in that civic action, because those puts those protective factors in place so that when trauma does happen, the effect is decreased. But it takes a community to do it together. I see there's a question. Is there an opportunity to use healing-centered engagement in health settings, which can be a place of re-traumatization? Absolutely. And thank you so much for asking. Yes, in health settings, you could absolutely do this. So one is, if you're a healthcare provider, knowing the patient's name, which is helpful. Two, making sure that you are doing the work of equity, and looking at diversity, equity, and inclusion, because implicit bias, we know, is innate in the healthcare field and all fields, but we know that there is medical racism that is happening. And recognizing the strengths of the patients that you're serving. Listening to what they are saying. I used to work in hospitals and with doctors for years. And when somebody would say, well, I believe in essential oils, or I believe in, using yoga or meditation or mindfulness, there would always be sort of like a rolling of the eyes, right? But that's taking away the person's sense that they are the agent of their own healing. So, that first one, it's knowing what is the person really good at, making a note in the chart, like this person is great at quilting. This person has 10 grandchildren and is raising, all 10 grandchildren beautifully. This person is a soloist at their church. And then bringing up those strengths to recognize that you don't see them as a diagnosis, but rather as a whole person. Also embracing whatever healing that they believe is helping them, and then integrating it into your practice. You can make healing as a collective by creating peer support space at your healthcare agency so that patients can have time together to, join, talk, share resources. And then really the Ubuntu in that healing space would be that the healthcare providers and the patients are all part of one community. And so figuring out ways that there can be interaction that is not so medical focused of I'm the expert and I'm going to tell you what to do, but rather shared decision making. Even thinking about the space that you're using, instead of an exam room, do you have a room that could be more equal in the status positioning of people? And then civic action, working with a group of patients and providers and saying, well, what could you all do together in that agency that would help with civic action? Is it panel discussions? Is it that you paint a mural on the wall in the clinic? Those are things that you can do in a clinic or in a healthcare setting that really would support healing-centered engagement. And I'm always happy to talk more about specific strategies. And in fact, when this presentation is done in a longer format, we have people sit down and really each break down into groups and talk about how would this look in your specific setting. And so in the last, 2 minutes before we have to move on and start closing up is, let's talk about what could it look like and we can use a school, because I see, I think it was Dr. Fulton who asked if this was happening in schools. How could we, yeah, school systems. What is something that a school could do to help kids to recognize the strength of the youth in the school and that the youth are part of their own healing? What's one strategy a school could use? Designate time for healing circles. Yep. So healing circles, great. And so that's giving space and time for youth to be part of their own healing, having peer groups. Yep, great. And then using play as healing and let children choose how they want to play. Yep, great. Child-directed play. And so how could a school as a community come together to heal the entire school rather than it being sort of smaller groups? What's something a whole school could do? So, yep, so train teachers and administrators on healing-centered engagement so that they have it in their mind, and that part of that training is how to use it in the classroom and how to use it in the school, and also how to use it between teachers and administrators. I think that's one of the struggles, is that sometimes we do training and say teachers use this in the classroom, but it doesn't talk about how administrators and teachers should use it with each other. Yeah, and so ceremony that is geared to honoring and recognizing healing that is student directed. Great. And then training students on healing centered engagement. Excellent. And then for Ubuntu, what could we do in a school that would help youth understand the idea of Ubuntu? That I am because we are. Invite families, that's right. So that we're broadening the definition of community, right? And saying we are all interconnected. So invite family and supports to join in on events. And, one example, when you think about graduations that happen in schools, they tend to announce person by person, right? And so they're like, oh, Johnny Smith, come on up, and they get certificates. Imagine if we said, oh, the fourth grade, everyone has graduated, or the fourth grade had an excellent attendance rate. That then it shows that they're all connected versus this idea of, well, I succeeded, so if this other person failed, that's not me, right? So the idea of collective celebration. And then finally, what is a civic action that youth in a school, that whole schools could do together that would help with collective healing? Some sort of a civic action. And this would be something that would help heal the community as well as everybody that comes in and out of that school. So some schools have painted murals. They could have a community event, a community cleanup. Great. Community garden. Exactly. So, garden. So those are just some concrete ways that as a community, people can come together to implement healing-centered engagement. We are at our time. I want to thank you all so much. And before people go, there is a survey that it would be very helpful if you could please complete to give feedback. If people have further questions or would like to discuss this with me, I will put my email address in. Sure, happy to share the PowerPoint. My email address is in the chat box, and I will put the survey link in the chat box as well. And again, thank you all so much. And I hope that we can work together as a community through our trusted relationships to heal Baltimore City. So the link is in the chat box. I hope you fill it out. Again, my name is Kyla Liggett-Creel, and I will put the it says error. Let me see if maybe I didn't copy it right. Let's try this. All right, can you let me know if that works? Oh, and it looks like somebody also put it in there as well. Excellent. All right, thank you. And if you would like a copy of the PowerPoint, please just email me and I will be happy to share it. Again, my email address is in the chat box. Thank you all so much and have a wonderful afternoon.